The final chapter of pregnancy, the third trimester, is where life prepares to meet the world. From week 28 to week 40, your baby undergoes astonishing growth and transformation. Organs mature, senses awaken, and the body strengthens for birth. Let's explore the extraordinary changes happening inside the womb during these last precious weeks before new life begins. The third trimester marks the final stretch of pregnancy, beginning at week 28 and lasting until birth. Inside the womb, a complex and delicate transformation unfolds as your baby, now called a fetus, prepares for life outside. By this time, the baby measures over a foot long from head to rump and weighs nearly 2.5 pounds. Every day, new layers of fat form beneath the skin, giving the baby a rounder, smoother appearance compared to the earlier trimesters. This layer of fat plays a crucial role. It will help regulate body temperature after birth. During week 28, the fetal brain undergoes rapid development. The smooth brain surface begins to form characteristic folds and grooves, allowing more neurons to fit within the skull. These connections support advanced functions such as breathing, sucking, and even dreaming during sleep. The nervous system becomes more organized, and by this stage, the baby can respond to sound, touch, and light from the outside world. You might notice your baby reacting to loud noises, your voice, or even gentle pressure on your abdomen. That'd be why week 30. The lungs are continuing to mature, though they're not fully ready to function independently. Tiny air sacs called alveoli start forming, and the body begins to produce surfactant, a slippery substance that will help keep the lungs open once the baby takes that very first breath. Meanwhile, the digestive system is practicing for its future job. The baby swallows small amounts of amniotic fluid, which travels through the stomach and intestines, helping the gastrointestinal tract mature. Around week 32, the baby's growth accelerates. Weight gain becomes rapid, sometimes as much as 0.5 pound per week. The baby's bones are now fully formed, but still soft and flexible, which is important for the birthing process later on. The skeleton continues to absorb calcium, iron, and phosphorus from the mother's body, strengthening bone tissue. Around this time, fingernails and toenails become visible, hair continues to grow, and eyelashes fully develop. One fascinating development during this stage is the maturation of the eyes. The eyelids, which were fused shut earlier in pregnancy, now begin to open and close. The baby can detect light filtering through the uterine wall, distinguishing between day and night. In fact, studies show that bright light can slightly increase fetal activity, while darkness promotes rest. The baby also begins to exhibit sleep cycles, alternating between active movement and quiet periods of rest. By week 34, the brain and nervous system have advanced enough to coordinate basic reflexes. The baby can suck its thumb, grasp the umbilical cord, and move rhythmically. These small yet vital actions prepare the baby for feeding and movement outside the womb. The liver continues to store essential nutrients like iron and glycogen, building energy reserves for the transition to independent life. Week 36. Most of the organs are nearing full maturity. The bones of the skull remain soft, connected by flexible sutures, allowing the head to change shape slightly during birth. The lungs are almost ready, producing enough surfactant to keep the air sacs from collapsing after the first breath. The skin, which was once thin and translucent, now becomes pinker and more opaque as fat deposits increase. By the end of this period, the baby's movements may feel stronger and more pronounced. You might feel powerful kicks, turns, and stretches as the baby runs out of space in the uterus. Eventually, most babies will naturally shift into a head-down position, known as the cephalic presentation, preparing for delivery. This positioning ensures the safest passage through the birth canal when the time comes. Inside this remarkable hidden world, every heartbeat, every breath-like movement, and every reflex prepares your baby for life beyond the womb. The final weeks are not just about growth. They're about readiness, adaptation, and survival. The womb becomes a living classroom where the baby rehearses the rhythms of life. While your baby is busy preparing for birth, Your body is also undergoing significant changes to support this final stage. The third trimester can be both exciting and physically challenging. As your uterus expands, it begins to press against nearby organs such as your bladder, stomach, and lungs. This pressure often causes shortness of breath, frequent urination, and occasional heartburn. You might notice swelling in your ankles, fingers, and face due to increased blood volume and fluid retention, a normal response to pregnancy hormones. Your breasts become fuller and more tender as they prepare for breastfeeding. Many women notice the leakage of a thick, yellowish fluid known as colostrum. This early milk is rich in antibodies and nutrients that will protect and nourish your baby in the first few days of life. Meanwhile, your skin may stretch and itch, particularly around the abdomen, as it adjusts to your growing belly. Applying moisturizers can help relieve discomfort. Another common change during the third trimester is difficulty sleeping. Finding a comfortable position becomes harder as the baby grows, and frequent trips to the bathroom can interrupt rest. Doctors often recommend sleeping on your left side to improve blood flow to the baby and reduce pressure on the major blood vessels. Emotionally, the third trimester can bring a mix of anticipation and anxiety. You may feel excited about meeting your baby, but also nervous about labor and parenthood. Hormonal changes can intensify mood swings, but gentle exercise, proper rest, and support from loved ones can help you feel more balanced. WY week 34 to 36. Your body begins to experience Braxton Hicks contractions, irregular, mild, tightening sensations in the abdomen. These are your body's way of practicing for true labor. They're usually not painful and tend to disappear with rest or hydration. True labor contractions, in contrast, grow stronger, more regular, and closer together. Recognizing the difference can help you know when it's time to go to the hospital. As you near week 38, your baby begins to drop lower into your pelvis, a process known as lightening. This can relieve pressure on your lungs, making it easier to breathe, but may increase pressure on your bladder. The cervix starts to soften and thin in preparation for delivery. You might also experience increased vaginal discharge or a bloody show, signaling that labor is approaching. Your digestive system slows down as hormones relax the muscles of your intestines, which can lead to constipation. Eating fiber-rich foods and staying hydrated can help ease this symptom. Hemorrhoids and varicose veins are also common due to the increased pressure in your lower body. Gentle movement and proper posture can reduce discomfort. As your due date approaches, your healthcare provider will monitor your baby's position, growth, and heartbeat closely. Ultrasounds or physical examinations can determine if the baby is head down or breech. If your baby remains breech, your doctor might attempt a gentle procedure called an external cephalic version to encourage turning before labor begins. Mentally, this is a time for preparation. Many parents finalize their hospital bags, install car seats, and organize the nursery. It's also a good idea to learn about the stages of labor, breathing techniques, and newborn care. The more informed and calm you are, the smoother your experience can be. Finally, around week 40, give or take a couple of weeks, your body signals that it's time. Labor begins, the cervix dilates, and your uterus contracts rhythmically to help bring your baby into the world. Once born, the baby's lungs expand. The first breath is taken, and the incredible journey that began as a single cell is complete. The third trimester is truly a miracle in motion, a delicate balance between growth and anticipation. Every ache, kick, and flutter is a reminder of life's most profound transformation happening within you. From the moment your baby takes its first breath, every struggle, every sleepless night, and every heartbeat will have been worth it.